you and I know that healthcare, we can't do everything digital, right?
Mm.
And
Mm.
likewise, we cannot do everything offline right now. And this pandemic outbreak has proven that, right? So how can we actually merge together? Some people call it OMO, some people call it hybrid care, whatever we call it, is really about bringing more values to the patients, to the providers, right? And of course, maybe to the payer, right? And hence, you know, we have teleconsult services, e-pharmacy solutions, you know, range, and we have the consumer healthcare, which is the offline services. And we have a content, you know, that actually we generate to educate the public on health and, you know, safety and things like that. So these are some of our partnerships and corporate clients that we're serving. And this is an interesting slide that we want to share that, you know, in terms of e-prescription, we launched to the market in 2017, right? Where, you know, the whole year we did about less than 500 e-prescriptions, right? Was very bad, right? And subsequently 2018, we started venturing into corporate solution where we actually, you know, started serving, you know, Hong Leong Bank employees. So Hong Leong Bank was the very first in the country, right, that actually adopted, you know, digital health, right?
Wow.
That all the employees, instead of going to panel clinic, they started, you know, seeing doctors online. That was 2018. And because of that, you know, we saw a lot of refilling of the prescriptions coming to us. So that year we did about 5.5K. And subsequently, because of more pharmacy joining, pharmacies also saw the opportunities, and we worked with some chain pharmacies and more corporate coming in. Subsequent year, it went up to close to 90,000 e-prescription that year. So not too bad, 2019. And that's all these are BC. So BC means that before COVID.
Before COVID.
Before COVID, right? So BC time.
That's
right?
A good one.
So all these are before COVID, right? So 2020, you know, and then we have a, you know, sharp raise thanks to, you know, more adoptions, right? Coming in, and also, you know, COVID-19 that actually, you know, accelerated the whole journey. And last year we did more than 330,000 e-prescriptions. So it's quite a blessed journey. And this might touch a little bit on your previous question, right? Adaptation and adoption.
Yeah.
And we look at the, you know, this is from, you know, some of the study, right? That, you know, asking about consumers, right? What do you expect in the future in terms of digital healthcare services, right? In the next 5 years, right? So you can see, you know, on the future, which is a red bar, right? Majority are quite positive on, you know, telemedicine, you know, self-diagnosis, digital healthcare solutions, things like that, and online pharmacy, right? So if you look at during this pandemic outbreak, right, in China alone, right, the adoption of digital health or telemedicine, right, is 900%. I mean, the top player like Ping An Good Doctor is crazy, right? And most of them is 100% over, 800%. In the region of Southeast Asia, we're looking at average about 150% in Indonesia or Singapore in terms of adoption in telemedicine during this pandemic outbreak. I think in Malaysia, maybe Haswan maybe can contribute a little bit. We're looking at probably about 70 to 100%, right? Increase in adoption on telemedicine during this pandemic outbreak. And definitely this pandemic outbreak has served as a catalyst, right, an enabler to speed up the process. Where we are right now, actually, without pandemic outbreak, we probably need another 2 to 3 more years, right? Probably Hassan will agree with me. Yeah. So pandemic is a disaster.
2025. Right?
Yeah.
Wow.
So in 3 years time, right? So it's crazy, right? So without pandemic outbreak, right, it's very difficult. Digital healthcare, and healthcare is the most complex industry, like it or not, and one of the most regulated industry. So hence, sadly, it's a least disrupted industry as of, you know, if you compare to other industry like banking or this, right? Look at it, banking, it should be very secure, right? But yet the disruption is crazy. But healthcare is very, very far behind banking industry. So these are some of the Southeast Asia player that, you know, in terms of telemedicine adoption. And this is a very interesting slide that, you know, in terms of adoption, right? So before COVID-19, you see, you know, the adoption is quite all right. You know, you might wondering why after pandemic outbreak, Hong Kong and South Korea still stay there. And this is one of the challenges, like Haswan mentioned, regulation.
Right.
So the regulation forbids them from, you know, pursuing digital health in the country. So hence you see before and, you know, after COVID-19, they're not moving in terms of digital healthcare space. But you see the rest like Japan, Indonesia, Singapore, Australia, China, they're moving towards higher adoption. So it's a very interesting slide, you know, that actually, you know, in terms of adoption of digital health. And this is this is 2018. Some of the players in Malaysia, of course, Dr. Ngpo is here, Dr. I think in digital healthcare, whatever we do, first rule of thumb, right, do no harm. This is what we learn in school. and no matter how much we want to disrupt or innovate, right, always remember that, we do no harm and provide values to the patients, right? And this is what I learned from the medical legal.
Oh.
What is not because Haswan mentioned about gray area. You're right. Digital health is a gray area because
Yes,
there's
yes.
no enforced law at the moment, right? So this is what I learned from the legal, right? That what is not forbidden is allowed. You follow the book, right?
Yes.
Because a lot of acts, right, are in 40s and 50s. Are they able to govern and enforce for today's and tomorrow's healthcare? Probably not.
Right.
I think ministry and government, they're aware of that. They're playing a catch-up game at the same time without compromising health and safety and the governance of it. So it's a very, very tough area. But at the same time, they leave a space for innovators like all of us to actually continue to innovate in a more secure environment. So hence the regulatory framework, all this to come in place, right? And we hope that this space, should be regulated, right? Because it involves the health and safety of patients. At the moment, everyone is self-regulating with their own guidelines and protocols and policies and things like that.
Yeah.
So this is us, and a bit of wrap up of 2021, what we did.
Mm.
So in a nutshell, that's what we do and who we are. I hope I give a little bit of glimpse of the telemedicine and digital healthcare space.